Joint General Secretary of the National Education Union. Welcome to you both. Dr Cannon, can I start with you? As a GP, do you disagree with anything you've heard today? Do the restrictions make your life, your work, easier or harder?
Well, they make it harder. I mean, the NHS is already very much crushed under the strain of 18 months of COVID. So we have huge waiting lists in secondary care, which are then sort of filtering back into primary care. And there's a lot of dissonance, both amongst colleagues and also amongst patients. There's not just the mental illness and the mental health harms that we talk about, but also a general level, which comes from poor employment, poor economy, everything. There's a general level of suffering and malaise in the community. And I think the uncertainty that we've had over the last 48 hours with the new variant is only adding to that. I mean, if you had an appointment today for a cataract operation, for example, in December, would you take that appointment or not? And these are the sort of things that are playing on everyday people's minds.
But you're not saying that we shouldn't be responding as a country in the way we are, presumably?
Well, what I don't like is when we pick the very low-hanging fruit. Let's just target the children, masks straight away in schools because they're easy to control. Everybody on the tube this evening when I travelled in wasn't really wearing a mask. Nobody is in shops, but we're telling children straight away they have to do that. So I think we have to be very careful, as your person in that VT just pointed out. Restrictions have harms. It's not just COVID that has harms. Restrictions also have harms. And now we have such effective vaccinations which protect our vulnerable. Even the benefits of those restrictions are questionable. So we really, really have to question what do we put in place against this new variant.
Kevin Courtney, would you welcome seeing children wearing masks for up to 6 hours a day in school, which is one of the measures coming in?
Well, that measure isn't coming in England because masks in secondary schools in England are in communal areas only. But I would welcome masks in classrooms, as in Scotland and as has just been announced in Wales, because we have to get a path through this pandemic. The path is vaccination. So I really welcome the announcements today on the expansion of the booster and the second dose for teenagers. But at the moment, there is a very large disruption of education because cases are so high in secondary schools.
You've heard the accusation from Dr Cannon that actually just turning and picking on the kids straight away is low-hanging fruit, and it's the most vulnerable people, you could say, not in our society in terms of COVID, but in our society in terms of what we should be giving them now to make them wear masks in schools.
So I don't think it's picking on them, it's helping them. Because what we see in Scotland is they have masks in secondary schools and they also have the isolation of very close contact, siblings, essentially, who if your brother or sister tests positive, you have to stay at home for 3 days, then get a test and only go back if you're negative.
OK, so let me just ask you this.
Is reduce the number of children who are missing education. So
Well, it doesn't, does it? I mean, it increases the number. If a child, just let me ask you this, if a child tests positive for Omicron or suspected of testing positive for Omicron in a class, should 29 others be sent home?
No, nobody's calling for that. But in Scotland, the overall
that's what's going to happen if it's close contacts.
In England and is falling, and I'm saying that's because they've got mask wearing and that isolation. So it actually has the effect of reducing the total amount of disruption of education.
What do you hear from that, Dr Cannon?
What I hear from that is this attitude of because COVID, because this, because that. I practice evidence-based medicine. There is not an evidence base for this type of NPI, this type of non-pharmaceutical intervention in terms of COVID. Vaccinations are fantastic. We know that. We know they work incredibly well. We know it works incredibly well when we have very strict isolation in terms of travel. Masks, to me, is COVID theatre. I wear a mask on the tube. I wear a mask when I have to work. Of course I do. But children need to be educated. They need to be properly educated, which involves non-verbal cues. It involves not being isolated. They've had 2 years of disruption. A child starting their GCSEs this year in year 10 has not been at school properly since year 7.
OK, let me just ask the National Education Union, what other measures would you want to see I mean, would you be telling schools that they should be cancelling communal activities like the nativity play, the end-of-year concerts? Would you prefer parents not to be going into school at this point, Kevin?
I mean, nobody wants that, do they? And the way to try and avoid nativity plays being cancelled is to try and stop cases going up in schools now. But what we're seeing in England is cases going up in secondary and primary schools week on week. And that's because we don't have enough non-pharmaceutical interventions in place. The vaccination...
But you could have masks in pubs, couldn't you? You could have masks in a whole variety of other situations that you're not advocating at the moment. You're just talking about children in classrooms.
Oh, no. Why would you say that? No, the government is introducing masks on transport and in shops, and that's very welcome. And that is the first place. But we're saying that the government needs to go a little bit further, as far as the government in Scotland and Wales have gone. And we think that in Scotland there is good evidence that that is reducing the number of cases in schools. That will make it easier to have nativity plays in Scotland. It's reducing the amount of the total amount of disruption of education in Scotland. It's a sensible measure. Well, it's not something that anyone wants to have in place long term.
Ellie Cannon,
vaccination is taking a long time to roll out.
So the First Ministers of Wales and Scotland they would argue, ahead perhaps of the Westminster government. They're talking about 8 days of isolation for anyone entering the UK. I mean, do you see that as an overreaction or as a very sensible next step?
Well, I think when we're talking about isolation in terms of travel, I think that's something that people now expect, and I think that's something that is 8 days worth of disruption. So that is 8 days of disruption. I think that's very different from the harms caused by a disruption of education or the harms caused by the disruption of lockdown. And as I've said, now that we're at the stage where we have very effective vaccinations, the government should be absolutely putting all of their efforts this week, never mind next week or whenever it is, this week into getting the country boosted. There are many people who phone my GP
Which, to be fair, is what the government said today.
Yeah, absolutely, but we've been very, very slow on the uptake, and it's always, as I've said, it's always the children who don't vote, who are the low-hanging fruit, who are straight away given the restrictions.
Do you imagine that we will be where we were last Christmas, this Christmas?
I don't think that the country could cope with another lockdown that we saw last year. I think the level of collective trauma within the community across the board will not stand another lockdown. And I cannot believe, with our level of antibodies, both from natural infection and also from vaccination, that we would need another lockdown. And now the harms of lockdown massively outweigh the benefits.
Thank you both very much indeed. Thanks for joining us.